One study found Omicron to be less likely to hospitalize patients. According to preliminary evidence from South Africa, the Omicron variation of COVID is more contagious but may have a milder disease than the Delta version, which is supported by 2 additional investigations from Britain and Scotland. Omicron and Delta hospitalizations in the first part of December were reviewed in the first research from the Imperial College London COVID response team, which looked at the number of verified PCR-tested cases. It discovered that among 56,000 Omicron and 269,000 Delta cases, individuals with Omicron were roughly 20% less likely to seek hospital treatment at all and 40% less likely to stay overnight or longer. 2/3 fewer Omicron patients were hospitalized than Delta patients in the second research from the University of Edinburgh, according to academics and other specialists. Omicron instances in Scotland were mostly among adults ages 20 to 39, who are substantially less likely than older people to have severe COVID cases, according to the research. Some experts told the Associated Press that although the Omicron variation is less likely to put a patient in the hospital, hospital systems might still face tremendous strain as cases pile up quicker because of the Omicron form's increased transmissibility and vaccination resistance. As the top standard in scientific study, the results have not yet been peer-reviewed by other experts in the field. Studies have some limitations, said Ascano. If, for example, the results are only applicable to the United Kingdom at a given period in time during a rapidly changing environment, other nations may not fare the same. It is possible that the younger participants in the Omicron group might have biased the results to less severe consequences induced by Omicron, according to Matthew Binnicker, the head of clinical virology at Mayo Clinic. Omicron may lead to less severe illness, but the facts are fascinating nevertheless. Omicron has a substantially greater transmission rate than Delta, which means that the number of persons who need to be hospitalized may rise even though they have less severe sickness in most situations. Omicron may be milder in South Africa, according to data from the country where the variation was initially discovered. South African epidemiologist Salim Abdul Karim noted earlier this week that Omicron's hospitalization rate was much lower than Delta's.